Ooh, good check. Oh, boom. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. All right, that was a pretty gnarly hit. I mean, it didn't look so bad, but like he kind of like, I guess the question is, I mean, one, was it a bad hit? We only have one angle on it that I saw, right? So certainly the NHL are going to take a look at it, because there is this question about, do you lift your shoulder or your elbow? I didn't see his elbow go in to that extent, just from that sort of two-dimensional frontal plane angle. I mean, maybe from a side angle you could see it, but did he purposefully go up or push back or something like that? I mean, there's so many mechanics for injuries that you got to look at, but I think it was that he just not only took him up off his feet, it was the way he landed and then went straight, boom, you know, kind of like a Steph Curry without the hands, right? Night, night. So that's got to hurt. But did his shoulder take the brunt of it? I mean, it's listed as upper body injury. So to me, it seems like it could have been like the amount of impact. Think about this. Okay, so looking at it again, there was this rotational dynamic, and you saw his leg slide into the board, and then he kind of, it's almost like a judo move, right? You just take him down, you know, in a way. But anyway, so he came down, and so let's just take 6'2", 100 and probably 220, maybe 250, right? A lot more muscle.
250 would be massive.
Yeah, so you're talking about 6 feet, 250, maybe a foot off the ground, but then he gets rotated, so then you have half his body weight with a, let's just assume the force is down here now, so you get this torque. So all of a sudden you're taking his entire body weight, because you have half his body weight, let's assume here, pinpoint, force going here, so you got a torque vector down here. Then from his skate, because you literally saw him horizontal, right? And then land. So you're talking about torque vector in this direction, torque vector in this direction, and then 250 pounds, let's assume now it's a solid rod, down like that, right? And his shoulder and head took the brunt of it. So accelerate 250 pounds that quickly, and he essentially dropped, let's say he's 6'2", he's now 6'4" with a couple inches off the ground, and then he's about 4 feet off the ground. So he's accelerating at a certain speed, let's just call it gravity, so 9.8 meters per second squared, and so, or, you know, 1 Newton. So then all of a sudden you're going down, and then, no, sorry, let me just redo that. Is it 1 Newton? It is 1 Newton. Anyway, so you're basically, you don't like this whole math thing, do you?
No, I'm just, like you said, is it 1 Newton? I hope that's a rhetorical question, because the answer's not coming from here.
You're right. Yeah, it is. Yeah. No. So anyway, so let's just sort of look at it from the perspective of, so anyway, so back to what I was saying. So then you've got this body, torque vectors, horizontal, I think I did it harder the first time. So he slams onto the ground at a slight angle. So his shoulder and his head take the force brunt of it. So if you take that acceleration and the body weight, so force equals mass times acceleration. So let's assume his mass, let's just say he's like 90 kilograms. So 90 kilograms times the acceleration, let's just assume it's 9.8 meters per second squared. And then you take that 4 feet. So how many centimeters down is that? Can you make some like
I'll put some
thinking magic, some cartoon stuff going on? So, and then you take him slamming down. That's the impact load, and it happens at point of impact. So his upper body, shoulder, took all that force, followed by a torque vector that continued because the force continued, and his head slams, ouch, into the ice. And the ice is inelastic. So it's not a rubber surface, it's not a solid hardwood, it is hard ice. I don't know if you've slipped and fallen on hard ice. I have. I've done it on the slopes. I've done it on a skating rink. I've done it out on a parking lot. I've done it in the driveway. It hurts. The only good thing about ice is if it's on a declining ramp on a driveway and you slip, you kind of, some of the force gets transmitted because your body transmitted into acceleration sliding down, which isn't fun when you hit the ground, but it takes a little bit of that away because you slide and you're wearing all your snow gear and your jacket, and it kind of creates some loose, low friction, sort of slippery surface, and so it offsets a little bit of the impact. But in this case, that was hard. He did not slide after that impact. He was down. Maybe not for the count, but he was down. So that's got to hurt. So what is his injury? Well, could be his head. Concussion protocol, I'm sure they did a quick concussion protocol on him for sure to determine whether there was any issues. Like you're going to ask him all the basic questions. You're going to ask him is, you know, what's his name? What's your date of birth? Who's the president? Let's ignore that question. What's the date? Where do you live? You know, what's your dad's name? You know, you're going to ask questions just to see if they have that quick recall. And oftentimes it's oriented to date, time, and place. And then you ask other questions depending on that. And then it's that fogginess that you want to determine. You're going to do a visual inspection quickly, then you do a detailed mini mental exam, you do a detailed physical exam, likely immediately on the bench, and then if you need to take him back, you do take him back, especially if there's any questions about that. And there's an entire concussion protocol, the NFL, the NHL, MLB, basketball. Are there head injuries in MLB?
Yeah, they get beamed in the head.
They get beamed in the head, but they have a helmet. We're not talking baseball. That's not important.
Hey, the Blue Jays are good.
I know. I'm sort of, yes, I've warmed up to baseball after the Blue Jays did so well and almost made it, but yeah. I've got a soft spot for Toronto, of course, being a Canadian. So anyway, now.
Yeah. So head could be, it could be neck, could be shoulder.
Yeah, so you basically go through that. You go through the concussion protocol, and he's listed as upper body injury, correct?
Yeah.
So maybe he didn't have the concussion, he didn't have a neck injury, but certainly your entire trapezius on that side, I mean, it can hurt. Did he have a clavicle fracture or an injury or an AC joint sprain? The common things are common. The shoulder separation, which is not the shoulder joint, but it's the AC joint, but we call it a shoulder separation versus a shoulder dislocation. We'll get to in another video. And so, there's so many different injuries you could have, but we only have limited. Could you have had a rib fracture? Could you have a chest contusion? Could you have had just a shoulder contusion, a big Charlie horse to your shoulder? Absolutely. Like when you have massive shoulders like I do, you don't get hurt because no one will come at you because they know.
And the muscle holds everything.
Oh, yeah. Let's cartoonify this. Yeah! So, like that's how it is when you're solid, right? Yeah.
You're like the ice.
The Rock. Well, actually, ice is better. Who's the ice?
Nobody.
I'm the ice. Yeah. There we go.
You're Canadian.
I think I'll get a lot of mocking negative.
For ice?
Yeah.
Ice is probably not the best name right now.
Yeah.
The ice.
Yeah, let's not use ice.
Ice man. Nope, that doesn't work.
No, That's Top Gun.
Oh, that's true.
So anyway, back to reality. So just whoosh, get rid of the cartoon. All right. So so yeah, it could be a lot of different injuries. You know, I mean, we'll find out more if we hear, and we'll give you updates as they come.